out, listeners. I'm your host this week, Justine Abson. This is the podcast where we tackle some of the trending topics, ideas, and best practice across health and social care. In this episode, we're heading stateside, so we're going to catch up with our incredible US team. We've got VP Glenn, we've got Sam from the sales team, and we've got marketing manager Ronnie. So we're going to be discussing everything from the challenges facing providers and patients alike to the critical role of compliance in delivering safe, effective care. Crucially, we're unpacking why quality can't be an afterthought and how the right technology can lead to better outcomes for everybody. Glenn, Sam, Ronnie, welcome to What the HealthTech.
Great to be here.
Oh, thank you.
I think this is the first time I've hosted with 3 guests, so this is very exciting. So let's start with some intros. Let's talk a little bit about your roles, what brought you to Radar Healthcare. So Glenn, let's begin with you, since you're our longest serving US team member.
I am indeed, the founding member of the US team here. So I'm Glenn Blatz. Nice to see everybody and join the podcast today. I'm the Vice President of Sales and Business Development based in Raleigh, North Carolina. And I joined the organization just about 2 years ago. So I just came up on my 2-year anniversary. So about 2 years ago, give or take, Paul Johnson, the co-founder and CEO of Radar Healthcare, sought me out to help build out the sales, marketing, and kind of operations to start to expand on the successes that Radar Healthcare has had in the UK. And that's really exactly what we've done over the last couple of years, is sort of build up the framework and the infrastructure to actually start to deliver sales and services. And it was really an opportunity to work for great leadership and really bring that Radar Healthcare vision of safety, quality, compliance, and risk improvement to a space that is kind of sorely lacking in technology and modernization. So it was an opportunity that I couldn't pass up, and I've loved every minute of it so far. So great to be here.
And Sam, as you're also part of the sales team, let's come to you next.
Yeah, absolutely. Thank you, Justine. And happy to be on here. Love to introduce myself alongside Glenn Blatz there. So my name is Sam DeJarnett. I am the sales executive for the US team based in Charlotte, North Carolina. So the role here for being a sales executive, obviously working with organizations in the United States to help identify those improvement areas with risk and compliance realms. Very excited to be part of Radar Healthcare. It's been, only 4 or 5 months. It's passed in a blink of an eye. But I did want to hop on and obviously join the mission of Radar Healthcare, with it being such an innovative solution and really the nucleus being improving patient safety. So something important to me, and excited to continue the path together.
Fantastic. And Ronnie, you've joined me in the marketing team, so I'll let you introduce yourself.
Yes, thank you. So about like Sam, this is coming from 4 months for me as well too. And I'm very excited to be a part of Radar Healthcare, coming from an acute care background in hospitals and health systems. So excited to bring lots of energy and fun things in terms of event planning and just meeting with our customers to bring our story to life. So excited to be here.
I love it. And Ronnie, I'm just going to ask you, what excites you the most about being part of the US team at this stage?
I think what excites me the most about being a part of Radar at this stage is really just the exploratory phase. We are still building a firm foundation and meeting with our customers and really just trying to increase our brand awareness. There's a bit of excitement and fun to that. So we get to do new things in terms of trying to see what we know works, but seeing how we can get the results from our customers and from the things that we do. It is very exciting to me. The creative process is also exciting. When we're building our brand, we get to put our name in some interesting places. And so it is exciting to see the response, again, from our customers and potential customers as well, too. So that is very exciting to me, how we're building and forging ahead with the Radar brand in U.S. territory.
Amazing. And obviously from a marketing perspective as well, it's great to have you as an extension of our UK team as well for us. So yeah, it's really good that to have you all with us. Glenn, I'm going to start with you to kind of delve into this a little bit more in terms of how do you see the US healthcare market evolving, and where does Radar Healthcare fit into that picture?
Yeah, that is a great question. So I think there's sort of three things that jump out at me. Sam and I just came back from a healthcare kind of tech focused conference on the West Coast. And really, just within the last number of weeks and months, there's been some legislation here in the US that is putting a lot of financial pressures and uncertainty, not only for kind of us as patients and consumers of healthcare, but the providers. So this financial uncertainty is really causing some heartaches and headaches for hospital and health system leadership. So that's number one. Number two is just the complexity and the size of these organizations. So, like most other kind of segments of the economy, there's scalability. Everyone's getting bigger, stronger, but that actually just makes them more complex and more difficult to manage. So that's something else that we can have an impact on. And then last but not least, just more specific to our space and what we're addressing as it relates to safety, quality, compliance, and risk. There really hasn't been much kind of in a way of technology advances, right? So the space is for the most part very reactionary, and not really proactive and predictive. So I think that's an opportunity for us as Radar Healthcare to bring that kind of change in mentality and just a different way of thinking about how they're addressing that core component. We kind of talk about those four pillars. I'll repeat them again, right? Safety, quality, compliance, and risk. And even going back to those financial pressures, it's even more important for these organizations to mitigate those costly adverse events and exposure to risk. And so I think we can have an even bigger impact on those organizations moving forward, just in this world of growth and uncertainty. And it's an exciting time for us to play a major role in how they're delivering care and how we can actually be part of their kind of clinical, operational, and financial success. So really exciting time to be in this space.
I think as well, when you look at some of the data from in the US with healthcare providers and things like that, the scale at which almost healthcare providers have grown over the years is absolutely huge, isn't it?
Yeah, I mean, back in the day, you would have just hospitals, right? You go to a standalone hospital and you would have those scattered across your states or your region. And that hardly ever really exists any longer. So they've all been purchased by other larger health systems. So I think we can all agree here in the US anyway, if you're in a major market, we just happen to be here in North Carolina, but you can pick Florida, New York, whatever it is. Each state, for the most part, has only a handful at the most of health systems that are supporting that population. And then sort of the other challenge that is some of those more rural hospitals, which is really going to be a challenge moving forward, especially with this legislation that recently came out, just more uncertainty for those rural hospitals. You might see more consolidation, but even the financial uncertainty for those rural hospitals is something to consider. But the landscape of hospitals and health systems has surely changed. And not only just hospitals and health systems, we also address senior living. That's happening in senior living as well. There's just more acquisitions all the time. And we even do some work in the behavioral health space, and it's really all the same across the board. But it's a challenge for those providers, but it's an opportunity for us as a partner to help them.
Mm. And I'm going to touch on that a little bit more in terms of, I'm going to come to you, Sam, in terms of those challenges. I know Glenn's just touched on them a little bit there. How we, helping to solve those, and what are the challenges are you seeing when you're out and about and you're visiting people in the healthcare world?
Yeah, it's a great question. I think Glenn did a good job on touching on a few of them that we do commonly hear. I think one challenge that comes to mind that's more obvious really just across the healthcare landscape, and I do think of one that is a big challenge, but a lot of people aren't really thinking of it. So that first one that's common across the healthcare landscape is staffing shortages. We all understand that that's part of it in every vertical, really. Hospitals, senior care, it goes across the board. So how are we solving for that? Really, Radar's platform is really streamlined and easy to use. So you can really do more with less. Now, what do I mean by that? Certain staff teams can handle, logging incidents, completing audits, right? Policy management with way less effort and way less headaches. So we've seen that really resonate in a lot of our conversations as we're going to these events and speaking with different customers. The other one that comes to mind that's really not top of mind, but when we do mention it, it does really resonate, is really starting to think about patient safety, mitigating risk in a proactive manner. So a lot of different organizations, it's more reactive in that type of situation. So gathering maybe patient safety data or, KPIs from audit performances. But it's been 3 months and they may check those stats or, analytics, if you will, once a quarter. So how do we solve for that? Yeah, Radar's platform. It's really unique in regards to that predictive, proactive type risk compliance data that we bring our customers. So those are two that come to mind.
And I think as well on that, there's sometimes people get a little bit wary of technology in terms of, kind of, is it, you mentioned doing more with less almost. People sometimes assume that means, less people, everything else. But actually, I think what it's there to do is it's still people first, tech second. And we've done a few podcasts recently where that's mentioned. In terms of if you get the right tech, it means that actually those people that are in those roles that, are there to look after patients, to put patient safety first, that allows them more time to actually spend with patients to kind of have that human approach, I think, a little bit as well, doesn't it?
100%. It's interesting you bring that up. I mean, we agree, Glenn and I, from that point you just made. But I mean, an event we just came back from, that was a theme of everyone knows we need to start implementing innovative technology, but it's not to replace the human element. That's still at the core of caregiving. So absolutely.
Yeah. And Glenn, how does our approach differ from other health tech providers in the US? So obviously you've kind of been in the industry. How do you kind of see the approach that we have in terms of that patient safety element?
Yeah, one thing that jumps out, and we hear this pretty regularly, is everyone has a different approach to patient safety and quality and risk exposure. But then also everyone really has their own culture and they're trying to develop a culture. That's really one of the most difficult things to do. And I think our approach and our platform can actually help support their unique culture of safety. A few things that we really promote and tout within our platform are things like lessons learned, right? So we actually want to be able to capture, not just capture details of a particular event, but we actually want to learn from those. And then what we're learning, we want to disseminate that and share that with the rest of the organization. The other is feedback loops, meaning if I'm reporting an incident and I don't hear anything back about that particular incident, maybe I'm less likely to report something else. So we actually want to get those lessons learned and those feedback elements back to the reporters. And those types of things really fostering that culture of safety, bringing everybody together. Everyone's sort of kind of bought in on the value and the approach of healthcare that the Radar Healthcare platform can help align with. And that really resonates with our customers. The other piece is really just around improvement. We like to think ourselves as the improvement company, right? So we just don't want to log information and manage incidents. We actually want to have hard, meaningful, and insightful data that actually shows that we're improving on things like falls or pressure wounds that are still so prevalent in healthcare today. So that's really our approach, is to just come in, really understand what their challenges are, help them develop that culture of safety, and really start to be partners in improvement, not just a vendor, not just another vendor in their ecosystem.
Yeah, that partnership bit is so important. And I think, again, going back to some of those things you mentioned as well, I think, it's not about ticking a box and kind of saying, yeah, we've done that, move on and on to the next thing. I think understanding that root cause analysis is such an important part of this. And that's what truly drives improvement and helps obviously prevent, hopefully, future incidents.
Yeah, exactly right. It's really a platform that touches everybody within the organization. So everybody is a reporter. Everyone is encouraged to log events, think about a good catch, things like that are sort of going by the wayside a little bit. And we just want to make it super easy and efficient to capture those types of things. All reports are good reports. There's something to be learned about all of those things. And if we can have a fast, easy, efficient platform to help capture those particular details, but all those lessons learned and those feedback loops, it really is an opportunity for them to realize that a technology partner could actually be a relationship and a culture development partner as well. So we're excited about that opportunity. We love having those kind of conversations with our customers and prospects.
And that leads me really nicely on. I want to chat to you, Ronnie, a little bit about customers. And obviously, I know you've been chatting to customers a lot recently, been out and about recently. So what kind of feedback are you hearing from our customers in terms of the platform and the support they receive?
So I've had a chance in the short few months to actually speak to quite a few customers, and I always want to find out really what was their purchasing motive. Well, why did you seek out Radar? How did you find out about us? And what do you really love about our system? And I can kind of put what they've said into 5 words. The first one is antiquated, right? Or antique. I'll use that word. Many of our healthcare partners were using paper. Can you imagine the hassle it is to chase down paper to get a signature for someone? And we live in such a digital age that things were getting lost, misplaced, or not reported because of paper. And so the first thing is, a lot of our customers chose us because they were looking for a system that would allow them to connect with all of the people they needed to inform, to let them know about our system. And again, access. A lot of I've been on the other side of healthcare implementation with innovative tools and things, and a lot of times customers are charged by the user and by the location and all of those things. And so Radar was a viable solution for them just because of the access that they were able to give to their employees and really make a difference where they were. I think the mobile technology was a hit and a seller for many people because they don't have to be tied or tethered to a computer. They can do it where they are, particularly with our hospice and home care customers. If an incident happens while they're in the home of a patient, they can easily record it right then and there. So they don't have to try to remember the details, remember the customer, remember all of those things. They can do it at the point of the incident. And so that was very important to some of our customers who you wouldn't think about dog bites. But when you are going to a home and they have a pet and those things, just this unfortunately happens as being a part of the job, and they're able to report those incidents. And what we also learned, a lot of times those incidents just were not being reported. So having Radar and having access to the system really helped increase the visibility of the things that employees were facing. I think the other one again is awareness, right? Having the tool to report allowed them to raise awareness in places where you might not have known these incidents were happening. So if you have a dog bite happening at the same home by different employees, you now know that you have a problem. You now know that you have a pattern, and you now know that you have the opportunity to do something different. The last two, action and analytics. Again, when you have the awareness in place, you can take action, and now you have the analytics that you can start to report those things that are happening. So those are all the things that I've learned in the short few time speaking with our customers. I've had to bucket it with the 5 A's because it helps me tell a story um, really about what our customers are sensing and seeing in the workplace.
It's really important that though, isn't it? Because that impact of what, those things on customers, on their patients, on whoever they're looking after, whoever they're supporting, to have that, to see that impact from using Radar, to understand how the system is kind of helping them in their everyday world is really exciting, isn't it?
It is very exciting. I've worked in healthcare quite the last 8 years or so. But being on this side, it's very impactful to see how, as Glenn mentioned, the 4 pillars: risk, safety, quality, and compliance. That impacts the bottom line, and the bottom line impacts the care of the patients. And so we are making a difference to make sure that our patients are safe and providers are safe as well too.
Definitely. Glenn, I'm going to just pop back to you for a moment to talk a little bit about customer voices. So, we've really, really briefly touched on partnership just there. So how do we ensure that customer voices shape the way we innovate, we kind of develop, we make sure that Radar Healthcare is constantly evolving to kind of support the US market?
Yeah, I think there's two things that jump out to me on that is, so one, we have just a wonderful connected community where our customers are talking to each other, they're sharing best practice, they're sharing insights. So I think they're helping each other to improve. But we also really encourage our customers to give us feedback on the platform itself. So we like to think that the Radar platform was really built by our customers. So we encourage feedback, we take that feedback, and a huge number of those kind of feedback items that we get are actually implemented and improving the system over time. So when we think about clinicians using the system day to day, managers utilizing the system to manage events and conduct audits, and even healthcare leadership looking at trends and looking at insights across the entire enterprise, all of those bits and pieces have really been informed by actual users. So we really take that to heart, and I think our customers appreciate that. Think about it from being a customer, right? If you kind of see something and say, hey, you know what, Radar, this might be a good idea, then you actually see it in the platform down the road. That's a great thing to see, and I think sort of rare in this space. So we kind of pat ourselves on the back, but we also applaud our customers for really helping inform the way that the product has been developed over the years.
And I think the other side of that is as well, that it's that collaborative approach, isn't it? So the more our customers talk to us about things, they're potentially not just helping develop the product for themselves, but obviously other people within that particular sector as well. So I know we've got our user groups and things like that where, we often hear that actually by sharing best practice between different customers as well, they learn from each other so it's a bit more of a community, and it's back to that partnership approach of not just being a vendor, but actually working truly together.
Yeah, you hate if you're buying software from somebody, right? You hate to be sort of on an island, right? Where you'd rather be part of that community and be connected to others that are doing the same things that you're doing. And it's a great big healthcare world, but at the end of the day, it's pretty small, right? Everyone sort of knows each other. They know where each other work. They sort of know everybody. And the other thing in healthcare too, they tend to, I know we talk about a lot of turnover in healthcare, but sometimes not the case. So there's a lot of healthcare kind of providers out there that are really kind of doing it for a really, really long time. And they know a lot of people, and they like to talk, and they like to interact. And they realize too that they don't have all the answers themselves. So Radar doesn't have all the answers ourselves. Our customers don't themselves, but together we can help solve those big challenges together. So that's really been a really nice thing to see, being part of the Radar team.
Ronnie, just based on the customer side a little bit, I'm just going to come back to you a second, because I know we recorded a podcast with one of our US customers, which is going to go out shortly. Have you heard anything when you've been chatting to them about, any kind of stories or like real impact examples that has really surprised you?
Yes, light bulbs. When speaking with one of my customers, we learned that they failed, I think, an audit or inspection because of a light bulb trail. They could not prove that it had been changed or checked or something like that. And so you don't think about those things in the healthcare setting, that someone has to check and change light bulbs. And so that was a aha moment for me, just how the system has something that, if the light bulb goes out here, we're just going to change it. But you don't think about having to report those things that they have actually been done. And that was something that stood out that I will never forget, how our system helped our customer make sure they don't fail any future audits, because now they have a track and a trail of changing just something as simple as a light bulb.
And it sounds really straightforward, doesn't it? But actually, like, somebody could sit and listen to this and go, oh, what difference does it, if the light bulb's not working for half an hour? But actually that could result in a fall, a trip hazard, somebody like actually really hurting themselves, which then results in a much bigger incident, that all because that light bulb didn't get changed.
Absolutely. And for us, I think it's just a regular light bulb, but it might be something sensitive that you have to order, or there might be a lag time, and so you just never know. But making sure that you have that trail, it was really impactful and helpful.
I love stories like that because you sort of find out those little tiny things, don't you, that actually could have a much bigger impact. So I think having those conversations are super important. Sam, I'm going to come to you now to talk about some events. So obviously, I know we've touched very briefly on it in this episode already, but I know you've been out at a lot of events recently. So have you got any standout moments or conversations that you've kind of taken away from those?
Yeah, man. A lot of great events, a lot of wonderful conversations, a lot of connections being made, which is a lot of fun for me personally. Um, I would say a standout conversation was at a more hospital health system focused event, and I was speaking with a leader of a risk and a compliance team, and it stood out to me because they were really kind of surprised from the idea of having a kind of a risk and compliance solution that is interoperable, right, to their entire tech stack. So, and what I brought up to them and what really piqued their curiosity is some examples that Radar Healthcare does do, and then that's being part of their tech stack. So, for example, panic buttons, right? Those are actual events. Medication thermometers, right? In refrigerators, those are events if it's goes above a certain exact degree. So just sharing with them the idea of having all those connectivity points in a kind of single source of truth, which in that example is obviously Radar Healthcare, was kind of eye-opening for them. And it was fun for me. We got to brainstorm any other ideas on that front and just have a chat about that. So that capability of Radar is fun to at least share and get everyone else's take on it.
It's really exciting, isn't it, when you kind of can share something that somebody doesn't really know about or doesn't think about, like the fridge monitors section, the thermometer stuff, like the impact of that temperature not being quite right on a medication fridge has such a negative impact. Residents can't get their medication on time. They've then got to go through reordering. There's a cost impact because of wastage. There's such a huge amount that comes off the back of something that sounds so small. Anything we can do that sort of then helps kind of make sure that can be monitored is always a positive. Ronnie, in terms of the events, how important do you kind of feel these have been for building relationships, building the trust in the US market, raising our brand awareness over there, and what we're kind of going to do going forward as well?
We have attended a few incredible events, and events are not, for me as a marketer, they're not just about our customers, but they're also about our competitors as well too. And so it is a window into what we're up against. We hear what our customers are facing. We can sense what our competitors are facing, and it really just helps us be better, helps us understand the market, and helps us understand how to market to our customers. We've done quite a few events, but I think the more impactful things is the opportunity to meet our customers where they are. We've had dinner with them. We've done competitive events with them. Sam is a pretty good golfer. Glenn too, but I still beat them.
We don't know
I don't
either.
play. I'll play golf at all. So not sure how that happened, but it is a real opportunity for us to hear firsthand how people are handling objections and handling the things that are coming their way. I really think the opportunity for events, it allows us, like I said, to raise our brand visibility. Radar is fairly new to the U.S., and so the name alone, our colors alone, they stand out. We've had some really engaging um, things to bring people to our booth. The pom poms are a hit. People are kinetic learners, I think, so they like to touch and feel. And so having something on the table where they can real time interact and spark a conversation with us has been really helpful as well too. So looking forward to more events. I think the more we do them, the more we have an opportunity to sit down and speak with people. I think our last event in Florida, it was not just about what happened at the booth. but the event had a few opportunities outside at a bowling alley, which also allowed for us to network and have some real conversations with people about what to expect in the marketplace and how Radar can help solve some of those challenges.
And again, bowling is a very competitive sport, so just adding competition in yet again.
Yes. Absolutely.
Glenn, if you could sum up our US mission in one sentence, what would it be?
Oh boy, one sentence, huh? I would say it's a tremendous opportunity to help our customers and our prospects, help them reimagine and modernize how they're addressing safety, quality, compliance, and risk. It's a space that is sorely in need of some technological advances. And as Sam had mentioned earlier, and I think I had mentioned earlier, the time is now to move away from that reactionary mode, right? That's not a recipe for improvement. A recipe for improvement is being able to be trending and predictive and proactive in this space to help our customers and basically our kind of provider partners thrive in what is still somewhat of an uncertain world. So it's a great opportunity for us, and we look forward to having more conversations with a whole bunch of folks moving forward. I know that was not one sentence, but maybe one really long run-on
I'll
sentence.
I'll let you off with that. I didn't think we were going to get it in one sentence. So yeah, no, I think it's just super important, isn't it, to kind of get the information out, get the brand awareness, get the kind of the impact that a solution like Radar and also just the right technology in place can have on then the efficiency and ultimately the quality of care for patients.
Yeah, I mean, it is really a great opportunity, and kind of just one kind of kind of latch onto what Ronnie had mentioned earlier, just around just conversations and developing relationships. That has really been an opportunity for us, obviously, to have these conversations and cover some of these challenges that our customers and prospects are having. But it's really important for us to do things like this so people can put, hey, Radar Healthcare, they're help meeting these challenges. Hopefully, there's a lot of people that are going to watch this podcast and get to know us. It's really important for us to get to know the market and the community. And it's not easy to do. So the more conversations we have, the more we learn, the better we can do to help deliver the needed kind of solutions that the marketplace is in need of.
Of course. And I'm going to now, my final question. So I always like to think with the podcast, if one listener can take one little thing away from an episode, then job done sort of thing. That's what we're here for. We're here to share information, share challenges, share best practice right across the world of healthcare. So Sam, I'm going to ask you first, what's the one thing you'd like any of the listeners to take away from today's episode?
It would really, what stands out, what I would like for them to take away is maybe some points we made just to start thinking about risk and compliance in a different way, right, in their organizations. And I know we've said it multiple times, so I'll keep it very brief. But as an example, the proactive way of thinking about it, right? Increasing patient safety, mitigating risk. So I hope if anyone's listening to this podcast episode is, some interesting points to get the wheels turning.
I like it. And Ronnie, what about you? What's the one thing you'd like listeners to take away from it?
Radar really is one central solution. Had a chance to kind of review the platform, listen to our customers, and it helps you again consolidate those systems that might be siloed. And so, if you're thinking about a healthcare partner, really consider Radar. It'll help you save some money, save time, save staff burden, all of those things with one central solution.
I'm really interested, actually. I'll just touch on before I ask Glenn. You shared something recently on LinkedIn as well about something. I think it's over 80% of incidents could be prevented, which is
Yes.
an incredible statistic.
According to the World Health Organization, a study that came out in 2021, I believe, 80% of healthcare incidents could be prevented. And so, we talked about the light bulb, we've talked about, just reporting all of those things. And so Radar really does help you avoid those hospital-acquired infections, avoid hospital falls, avoid all of those things because you're tracking and reporting the data to keep up with your compliance, to keep up with your quality, and to make sure things are safe. So, absolutely, one central solution.
And Glenn, what about you?
Yeah, I think it's just be open-minded and be curious. There's a new player on the block here, and we want to have conversations and be engaged. So you have choices out there as a consumer. When I talk about the provider world, Radar Healthcare could be a great choice. So be curious, be open-minded, ask questions, have a look at the platform. I think you'll be surprised, pleasantly surprised at what we can offer and how we can help you improve. And yeah, just be curious, have a look.
I think it is. It's such an exciting time for us to be over in the US and, kind of making a mark in the healthcare world over there. And like you said, Glenn, earlier, it's not just hospitals, it's senior living, it's behavioral health. There's so many elements that we can help with. And, as we kind of grow our partnerships and our customers over there, then yeah, I think it's a very exciting team to be part of. And yeah, to be making a difference, basically, which is what we're all here to do. We're all here to kind of improve patient safety and make that difference to people who are potentially undergoing anything. So thank you very much for everybody, for all three of you for joining me. I'm going to obviously end with our usual closing moment. We like to ask our guests to share their What the Health Tech moment. So this could be something weird, wonderful, emotional. We've had stories from all over the place. But it's really nice to hear people's standout experiences from their life within healthcare. So, Glenn, I'm going to ask you if you can share with us your What the Health Tech moment.
Yeah, I think I've got a pretty good one. I'm going to go back in the time machine. Gosh, how many years ago? 22 years ago. So I used to sell some specialty infusion devices to hospitals. And one of the segments that we specialized in were syringe pumps for NICUs, so neonatal intensive care units. These are the babies that are born prematurely and really the most compromised of patients. And I spent a lot of time in some local hospitals with the nurses and nurse managers, really being hands-on with how they're delivering medications to these little tiny babies. So lo and behold, my daughter gets born prematurely, and my wife and I are walking into this NICU, and my little baby is now in the hands of the people that I was just, working with day in, day out. So I went from being a partner-vendor relationship to actually being the father of a patient that they were caring for. So it was really interesting and emotional to be on the other side of that healthcare, experience, and how that nursing community really sort of embraced me. And, it was really just an amazing experience to kind of walk into that NICU and they're like, oh, well, I know this guy. And that last name looks familiar because that baby just came in, and they were kind of like, oh, okay, well, we're to welcome this guy into our space as a parent of a patient, not a vendor walking in helping them with equipment. So that was really a special moment for me and my family, and just something I remember as sort of my career in the health world.
Oh, that's amazing.
And
I think
fast forward 22 years, and she's a beautiful grown-up young woman living her life.
amazing. And that's what's so lovely about these moments is you hear things that from a personal side, I think a lot of the time, which is really lovely. And I think we forget how many times we're all probably impacted by something in healthcare. So yeah, I think that's a lovely way to end our introduction to you guys as a team. So thank you very much to you all for the discussion today. We're super excited about Radar Healthcare's journey across in the US and the impact that obviously we're already having on our US customers, and there's a lot more to come. So yeah, I'm looking forward to having you back on at some point to chat a little bit more about where we're going. And to thank you to everybody else for listening. Join us next time for another new episode. Don't forget to rate and subscribe. And if you've got any questions for us or our guests, please email whatthehealthtech@radarhealthcare.com.